place a number of protocols to protect vulnerable residents from the coronavirus, and also clarifies earlier orders. For example, the order will require masks for hotel workers, guests, and visitors, individuals using taxis, ride shares, private transportation providers, workers and customers of food sellers, and strongly encourage for workers and individuals using public transit. The mayor's order also extends our public health emergency to May 15th, May 15. On Friday, we're going to share more information about our schools and government operations as best we can, but we know that we will need until at least May 15th to continue flattening the curve. And to help protect African Americans who we know are disproportionately suffer from some of the underlying conditions that make COVID-19 so dangerous, this mayor's order also charges the DC Department of Healthcare Finance with identifying residents who may have an underlying health condition that makes them more vulnerable to severe illness and death from COVID-19. Then the agency will conduct outreach to those individuals to provide them information on steps that they can take to lessen risk of contracting the spread of COVID-19 and determine whether the individual has symptoms of COVID-19 and provide information on any medical care, case management, or other support that may be appropriate for individuals who are at heightened risk. I've quoted Dr. Birx before in saying that we have to be almost perfect to flatten the curve according to some of the White House's estimates. And I want to thank DC residents and businesses who have been doing everything that they can to flatten the curve by staying home. But another way to strive for excellence is to overcome long-standing health disparities experienced by African Americans. And one famous such medical expert and Washingtonian was Charles Drew, who said excellence of performance will transcend artificial barriers created by man. And so we continue to be charged with doing all that we can and all that we must to equalize opportunities and experience for African Americans in our city. We aim to protect DC residents and save lives, and that means doing everything we can to protect our most vulnerable residents. The remainder of the slides will talk about those vulnerable populations. And they include residents who are in the custody of DC government, residents who live in congregate settings like nursing homes or group homes, residents who stay in our shelter system or who are unsheltered, and it also includes residents who are at home and in vulnerable situations because of domestic violence, or because they have a mental or behavioral health need, or because they're children who may not be in a safe home. So you can see, if we can just go back a little bit, you can see the residents who are in the custody of DC government are in DC Corrections or DC Jail, the Department of Youth and Rehabilitation Services, and we have 2 facilities, New Beginnings in YSC, but we also have young people who are in the custody of DYRS who are in community-based settings in St. Elizabeth's Hospital, which is our hospital. We also have residents who are in community-based provider care, often supported by DC government, and those include long-term care and intermediate facilities, disability service providers, and home health service aides who are providing direct care to DC residents. We also have residents who are in one of our homeless shelters, or who we serve who are unsheltered. And we have residents who are at home, who have mental and behavioral health needs that we support, seniors who we support through various programs, We know that we have young people and people of all ages who may be experiencing domestic violence and who need resources, and we have others who are homebound who can't get out of their home. So those are a number of the vulnerable populations that we'll talk about today. So I first want to share some information about how we are protecting residents in our custody. And you can see now we're first talking about our criminal justice system. And you will frequently hear two terms referred to at DC jail. We have two buildings. The Central Detention Facility, which is the largest, its current population is just over 1,000 people with 1,043. And the Central Treatment Facility, and its current population is 398 people. And when Kevin speaks, Deputy Mayor Donahue speaks, he'll talk to you about our entire experience in addressing the pandemic in DC jail. Also, New Beginnings, one of the DYRS facilities, currently has 22 residents, and the Youth Services Center has 20 residents. And on Monday, I shared with you that we lost a first resident, first inmate of the DOC facility. And yesterday, we also shared that we have 56 confirmed cases at DOC facilities. 32 residents are recovered and were cleared to return to the general population. Of course, the question is, how are we mitigating the spread of the virus? And so I'm going to talk a little bit about some practices that have been in place at the DOC to do exactly that. In addition to screenings upon entry, the use of quarantine and isolation, and the enhanced use of PPE, the DOC has modified its resident movement and activity to reduce the risk of transmission. Currently, residents are only moving from their housing units for court appearances, medical and dental appointments, work details, and legal visits and calls. In terms of our DOC population, we are making changes where we have local control to do exactly that. MPD, for example, has arrested fewer people, down from the average of 92 arrests per day before the public health emergency to about 29 arrests per day last week. We are also using good time credits to make more residents eligible for early release. And in the past 4 weeks during our response, the jail population has dropped 22% by about 406 inmates. We have also focused on reducing our youth population in DYRS facilities. Over the last 3 weeks, DYRS's population at New Beginnings and the Youth Services Center has been reduced by 40%. And those facilities are taking a number of steps as well to protect young people who live there, including testing and isolating any young person with symptoms, quarantining new residents, and ensuring PPE is provided and used in accordance with CDC guidelines. And so DYRS continues to take those steps to keep the young people in their care safe. Of course, DOC and DYRS residents are not the only residents in our custody. We also have vulnerable residents living at St. Elizabeth's Hospital. And sadly, 4 residents of St. Elizabeth's have passed away due to COVID-19. Currently, 9 of the hospital's 12 units are on quarantine, which includes about 60% of the patients. And you can see as well that we have 28 positives among our St. Elizabeth's patients. And we have 47 positives reported among personnel at St. Elizabeth's. In addition to ending most in-person visitations, as we have done at our other facilities, the Department of Behavioral Health is also working to accelerate the discharge of patients where clinically appropriate by prioritizing them for supported housing in a mental health residential placement. Since March 27 patients have been discharged and another 4 are projected to be discharged from St. Elizabeth's. In addition, residents who are in custody, we also have other vulnerable populations, which I mentioned earlier. Populations living in congregate settings such as nursing homes and group homes for residents with intellectual disabilities, as well as residents who receive services in their homes. So we'll talk a little bit more about those community-based providers. Nursing homes have been a focus of this pandemic. We have seen how quickly the virus can spread in these congregate settings, and given the advanced age and often complicated medical histories of the residents of nursing homes, it can be particularly fatal. And since we witnessed this tragedy in Washington State, we have been focused on how to support our nursing home providers. DC Health is working with our long-term and intermediate care providers as well. Skilled nursing facilities and assisted living facilities are instructed to report every case of resident or staff infection to ensure that they are getting the proper guidance from DC Health. Additionally, staff observe residents in these facilities for symptoms every 4 hours, and residents who display any possible symptoms of COVID-19 are to be tested. The Public Health Lab is supporting this testing. We have also provided these facilities with PPE, and there you can see how much and what has been distributed. And DC Health is also providing tools to help facilities conduct risk assessments, including information regarding staff leave, resident quarantining, and monitoring of symptoms. This week, DC Health and the CDC visited several long-term care facilities to offer support and gain a better understanding of how guidance is being followed. And this was one such federal investment that I acknowledged earlier in the week in a call with the Vice President. They do these sites, when they do these sites visits, they are looking at everything from how much hand sanitizer is being used to how we can better support testing for residents and staff. As you can see, I think the list before you are all of the long-term care facilities in the district. Some of them will be very familiar to DC residents, including Carroll Manor, Forest Hills, Inspire, the Little Sisters of the Poor, Knollwood, Lisner, Lewis Hurt Home, Stoddard Global, Thomas Circle, Transitions, UMNC, and another unique facility. So these facilities report that a total of 30 employees have tested positive for COVID-19, and 78 residents have tested positive, and they continuously are testing. So that is today's information on testing. In addition to our long-term care and intermediate care facilities, we are also supporting our home health providers and our disability service providers. And it is vital that people under their care can continue to safely access services. One of the ways we are preventing the disruption of services is by providing PPE to home health care workers and providing additional flexibility around services and hiring for providers who support our residents with intellectual and developmental disabilities. Another very vulnerable population that we are focused on is our residents who are experiencing homelessness. And we know that homeless shelters pose a particular risk And similar to other congregate settings we've spoken about, we're exploring every option to make them safer for our residents. Sadly, 4 residents who are part of the homeless service system have died due to COVID-19. 2 of these residents passed away in a hospital after being admitted, and 2 residents passed away in the community. We know that we have cases at several shelters around the district, and we're very focused on how we support those who have tested positive, as well as our entire shelter population. One of the things that we did at the very beginning was to establish a remote quarantine site. These are hotel rooms that we are providing to residents who need to quarantine or isolate but don't have somewhere safe to do that. Right now, we have 284 people in remote quarantine, and 229 of those people are from our homeless services system. So you see there that we have tested and found positive 62 people. 225 people are in remote quarantine. Most recently, we also began proactively working to remove some of our medically vulnerable people who are in shelter into hotel rooms. These decisions are based on age, underlying health conditions, and a medical assessment. We have talked previously